close your eyes for a moment and imagine breathing in something you cannot see, something you cannot smell, something you cannot feel. And yet, that single breath could change your life forever. Tuberculosis, an ancient disease, a silent predator, an airborne killer that still walks among us in this modern age of medicine and technology. Many people think TB is a disease of the past, something that existed in history books. But the truth is far more unsettling. Every single year, millions of new cases are recorded across the world. Millions. And hundreds of thousands lose their lives to a disease that is both preventable and curable. Tuberculosis is caused by a bacterium known as Mycobacterium tuberculosis, a slow-growing, stubborn, acid-fast organism with a waxy coat that makes it difficult to destroy. It primarily attacks the lungs, but it does not respect boundaries. It can travel beyond the lungs into the spine, the brain, the kidneys, the lymph nodes. When it spreads like this, it becomes even more dangerous. The tragedy is not just the bacteria. The tragedy is where it thrives. TB flourishes in poverty. It spreads in overcrowded rooms. It takes advantage of malnutrition. It strikes hardest when immunity is weak. In regions where HIV is prevalent, TB becomes even more aggressive, more opportunistic, more deadly. It is not just a medical condition. It is deeply connected to social conditions and inequality. But if the immune system weakens because of stress, HIV infection, malnutrition, diabetes, or aging, the prison walls collapse. The bacteria awaken. They multiply. They destroy. Then the symptoms begin. Now here is what makes tuberculosis terrifying. It spreads through the air. When a person with active pulmonary TB coughs, or sneezes, or even speaks loudly, tiny droplets containing the bacteria are released into the air. These microscopic particles can remain suspended, waiting. And all it takes is for someone nearby to inhale them. No handshake. No sharing of food. No physical contact. Just air. Once inhaled, the bacteria settle deep within the lungs. The body recognizes an invader and immediately launches a defense. Immune cells surround the bacteria, attempting to imprison them within structures called granulomas. In some people, this defense works. The bacteria become dormant, silent, inactive. This is what we call latent TB. The person shows no symptoms and may not even know they are infected. But if the immune system weakens because of stress, HIV infection, malnutrition, diabetes, or aging, the prison walls collapse. The bacteria awaken. They multiply. They destroy. Then the symptoms begin. A cough that refuses to go away. 2 weeks, 3 weeks, longer. Fever that rises quietly, especially in the evenings. Night sweats that drench the bed sheets. Unexplained weight loss. Chest pain. Fatigue that drains every ounce of strength. And in severe cases, coughing up blood. Inside the lungs, the bacteria create cavities, hollow spaces where healthy tissue once existed. Breathing becomes painful. Oxygen exchange becomes compromised. And if treatment is delayed, the infection can spread through the bloodstream to the brain, causing TB meningitis, to the spine, causing deformity and paralysis, to multiple organs, leading to death. But in the face of this danger, medicine has given us powerful weapons. One of the most important is rifampicin. Rifampicin is not just another antibiotic. It is a cornerstone of tuberculosis treatment. It works by blocking bacterial RNA synthesis, essentially shutting down the bacteria's ability to produce vital proteins. Without these proteins, the bacteria cannot survive. But here is something crucial. TB is never treated with just one drug, because this bacterium is intelligent, adaptive, resistant. That is why treatment involves combination therapy, commonly rifampicin, isoniazid, pyrazinamide, and ethambutol. Together, they attack the bacteria from multiple angles. Treatment is long, at least 6 months, and every single dose matters. Rifampicin has a unique effect. It can turn urine, sweat, saliva, and tears orange red. Patients sometimes panic when they see this. But it is harmless and expected. What is not harmless is stopping treatment halfway. When patients default on medication, the bacteria learn. They adapt. They become resistant. This leads to multi-drug-resistant tuberculosis, a far more complicated, expensive, and dangerous condition to treat. Drug-resistant TB can take years of therapy, and has lower success rates. This is why adherence is not optional, it is life-saving. Diagnosis, therefore, becomes critical. When someone presents with a persistent cough lasting more than 2 weeks, TB must be suspected. Laboratory tests such as sputum microscopy using Ziehl-Neelsen staining can reveal acid-fast bacilli under the microscope. Modern molecular tests like GeneXpert can detect TB DNA within hours and even identify resistance to rifampicin. Chest X-rays may reveal cavities and lung infiltrates. Culture remains the gold standard, though it takes time because the organism grows slowly. The earlier we detect TB, the faster we can interrupt transmission. The faster we can protect families, communities, nations, and prevention is possible. The BCG vaccine offers protection, especially in children. Proper ventilation reduces airborne concentration. Early screening of high-risk individuals saves lives. Covering the mouth while coughing limits spread. Completing treatment eliminates the reservoir of infection. Tuberculosis is not unstoppable. It is airborne, yes. It is dangerous, yes. But it is preventable. It is treatable. It is curable. The greatest threat is not the bacteria itself. It is ignorance, stigma, and delayed action. Tuberculosis does not discriminate. It moves silently. It spreads invisibly. But with knowledge, vigilance, early diagnosis, and proper treatment, we can break its chain. The fight against TB is not just the responsibility of healthcare workers. It is the responsibility of communities, governments, individuals. Because sometimes, the most dangerous enemies are the ones we cannot see. If this message has enlightened you, share it. Spread awareness. Because awareness is the first step toward elimination. Tuberculosis may be ancient, but together, we can ensure it does not define our future.